Dr. Stephanie Kappel, a cosmetic dermatologist in Newport Beach, California, and today I'm going to be talking about melasma. And the reason why I wanted to talk about melasma is it's about the end of the summer, it's August, and it's kind of towards the end of the summer, early fall, and that is when melasma is usually at its worst for all patients in the US at least, because I know that the time change and the sun exposure can be a little bit different. But where I practice in Newport Beach, California, usually melasma starts to become as bad as it's going to be in August, September, because we've had a whole accumulation of sun exposure and being outside and living life outdoors, which is perfectly fine to do, but it can wreak havoc on our skin with respect to hyperpigmentation. So before I move on and talk about the topic of melasma, I just wanted to welcome you to my YouTube channel, and I love our skincare derm nerd family that we have here. And every week I drop knowledge on a different topic that I'm seeing in my clinic a lot, or people are asking me in comments or DMs on Instagram. And I feel like this is a great way to address comments and topics that are happening in dermatology and aesthetics, and seeing what like the buzzwords are and what's going on. And there's constantly new developments and constantly new discoveries made in the field of aesthetics and dermatology. So I like to keep you guys updated and in the know with respect to new advances, techniques, technologies, whether it's skincare, lasers, energy-based devices, or just skincare in general, new discoveries that are being made in the skin. So be sure to subscribe to my channel if you haven't already, and hit the bell for notifications every time I post a video. I post a video every Sunday morning, and sometimes sporadically in between, I'll post some YouTube shorts or just a video here and there when I have fun topics arise in my clinic, or a little BTS behind the scenes in my clinic, or at home when I'm being a mom with my kids, or just everyday stuff. So I wanted to thank you guys for joining me, and I'm so glad that my YouTube family is growing. And also, as a dermatologist, I want to say that I'm not paid or sponsored by any companies at all. So I've been in practice for 15 years, and I'm old now, but I've been in practice for 15 years. And even when I was a recent graduate after completing my residency and fellowship, I was offered and have been offered by companies paid partnerships, which I refused to do because I did have a mentor who told me, Stephanie, you can't be bought or sold by any company. You want to be able to promote and talk about different treatments or procedures that you really wholeheartedly feel passionate about. And for those of you who are my patients, I'm very passionate about dermatology and skincare, and I only promote what I feel works, and that may change month to month or year by year as the technology keeps improving or things keep changing. So I don't do any paid sponsorships. You won't see any coupon codes with my videos. Now, I do have my own skin line that I formulated myself. I didn't white label it. I engineered every molecule of every product that we have by myself, and I engineered that for my patients and for my followers, but I don't do any paid partnerships with any big companies. So I wanted to make that very clear, because I know there's a lot of dermatologists and MDs out there that are taking paid sponsorships. So I wanted to just make that very clear. So before I move on to talk about melasma, I wanted to say there's various forms of melasma, and melasma is one of the most difficult skin conditions to treat as a dermatologist, because it can vary with respect to how deep the pigment is, with the skin type, and with the exposures that are causing melasma. So a lot of people think that if they protect themselves from the sun or they stay inside, that they're safe from melasma, when in fact it can actually happen from heat, or even infrared heat that's being emitted from our devices on a daily basis, or even doing things like hot yoga or things that are going to increase your body temperature can stimulate the melanocytes, which are the pigment producing cells in the skin, to secrete more melanin, which can cause hyperpigmentation and patchiness in the skin. So it becomes really important to target different depths of melanin distribution in the face, and that may vary not only within each individual patient, but even in the same patient. Somebody may have melasma patches on the forehead that are superficial, or may have more stubborn on the driver's side, mainly more stubborn melasma patches that go deeper. And so different patches or areas of hyperpigmentation may respond better than others to certain treatments. So say, for example, you have like a vitamin C or like a hydroquinone or a non-hydroquinone skin brightener that you're using, and you say, everything cleared except for this one spot on my cheek, I can't get it to go away. Usually that has to do with the pigment deposition. If you look at skin under the microscope, which I spent decades doing, and I think it's the most fascinating thing ever, but when you look at the skin, you have the epidermis, which is several layers, and then you have the dermis, and then you have the subcutaneous fat, and you have these little melanocytes, which have almost like these little finger-like projections that go out into the keratinocytes, and they distribute pigment and melanin into the skin. When somebody has a very even tone and almost that that glow, that means all their melanin is in the same dermal plane. And when it's patchy under the microscope, if you look at a melasma patch where it's darker here, lighter here, kind of medium dark here, you look at under the microscope and you see the melanin distribution is kind of like full thickness in some areas, only sometimes in the mid-epidermis in some areas, and it's just very patchy under the microscope. But when you can get all the melanin to be in the same dermal plane, that's when people have that beautiful glow. So patients will often be worried that if I use some pigment brightening active ingredient in their skincare products, or if they do a laser, that they're going to lose all the melanin. And that's not the case. When you treat melasma correctively and safely, then all that pigment gets distributed in the same dermal plane. You don't lose the pigment and you don't take it away. You just bring all the melanocyte activity to an equal level to where they're all producing the same amount of melanin at the same rate in the same plane. And so that is what the goal for treatment of melasma is. Now that could be achieved with lasers, it could be achieved with certain actives in your skincare, it could be a combination of both, and it can also just be sometimes by using photoprotection, which not only protects against UV light, but also infrared light and HEV light and blue light that's emitted from our devices, or fluorescent lights, or lights in our office or at the gym. So it's really important to understand how melasma behaves, and just to not get discouraged, because if someone has melasma and they've failed a treatment, you just have to find the treatment what's right for you. And what may be right for you maybe not be right for a friend or a loved one who also has melasma, because everybody has different thickness of skin, different genetic compositions, different melanocyte activity rates, and so that can vary patient to patient. So if you're reading something online and say, wow, this person had a great response to this laser and I didn't, it's okay. You just have to go to a provider who's very comfortable with melasma, very comfortable with lasers, and very comfortable with pre and post care after laser, or just very comfortable with different active ingredients to treat melasma, because there's so many, and it's a good thing that there's so many, because it gives people options to find out what works out, best for their skin. And once you achieve results, like I see melasma all the time in my office, and I personally struggle with melasma. If you look at pictures of me in college, I also always had these hyperpigmented plaques on my cheek and my forehead. And with both pregnancies and breastfeeding with both my kids, my melasma went crazy. So I struggle with it on a daily basis too. And if I don't do lasers periodically to relieve that melasma or correct it with certain skin brighteners, then my melasma goes crazy too. So I understand what it's like, and I've suffered, with melasma my entire life since college. So the main thing is to not only correct the melasma, but have something that you can do to maintain results that's reasonable. So sometimes, people have a laser treatment and their melasma looks great, but then they kind of fall off the wagon. They don't use sun protection, or they don't use some maintenance antioxidants or brighteners to kind of maintain their results, and the melasma will just come right back. And that's frustrating. So you want to protect your investment, protect your time that you've taken into getting the melasma clear, and just sustain the results. It's a lot easier to maintain results than it is to getting the results in the first place. So going from having melasma to clear skin may take a little bit more effort. It may take 2 or 3 laser treatments and combination therapy with certain active ingredients, diligent use of vitamin C, sunscreen for a couple months to get you there. But then after you achieve clearance of the melasma and knowing what your triggers are, you can maintain those results year after year by just using various antioxidants or non-hydroquinone skin brighteners and skincare. So now on the topic of lasers for melasma, because you can see conflicting evidence. If you look online, some people will say stay away from lasers, you can't treat melasma with lasers, or it can make it worse, or they don't work. So here's the T on lasers for melasma. You have to go to a laser specialist who actually knows what they're doing. And I'm not being condescending when I say that. There are med spas, a dime a dozen around here. They have IPLs, they have microneedling. But if you go to a true laser specialist, a board certified dermatologist, we get a lot of lasers in our fellowship and residency training, and then who's done a fellowship in lasers. You can check, the ASLM's American Society for Dermatologic Surgery, or American Society for Laser Medicine, ASDS. There's lots of societies where you have to do an ACGME fellowship in lasers, where you do thousands and thousands of cases with a world-renowned laser expert behind you. I mean, this is the kind of training that if you really want to put your trust into someone who knows what they're doing, you have to do your research and go to a laser specialist who knows what they're doing, because it can make things worse. So if you have the wrong laser or the wrong settings, it can make melasma worse, or it could stimulate those melanocytes to make more melanin, which worsens the problem, or even worse, it can clear the melasma, but then you get post-inflammatory hyperpigmentation from the traumatization of the laser. So there's very specific lasers, and there's very specific settings within those lasers that you have to use in order to treat melasma. Now, I'm fellowship trained, and I actually did my dermatology residency at UCLA, which is in the middle of West LA, where it's like the epicenter of cosmetic dermatology. So we got a portion of our derm residency was cosmetic and laser. So I feel very fortunate for that. But at the same time, I came out of residency and fellowship really well versed and very comfortable with lasers. But if you go to a provider who's like, no, you shouldn't have a laser because it will make your melasma worse, then just say, thank you, I'm glad you didn't treat me, and I'm going to go to somebody who can. So, and this goes for all skin tones, even darker skin tones. If Fitzpatrick 5, 6, African American, Asian, Latina, every different skin tone is definitely amenable to laser therapy, but you have to have the right laser with the correct settings. So what lasers are safe for darker skin tones or for patients who have melasma with any skin tone? So Clear and Brilliant, the 1927 nanometer handpiece, is important for lightening up melasma. It's a very safe and effective, very superficial laser. So it's not as aggressive as some of the more ablative or more aggressive lasers. However, if you do more treatments with a more superficial, lighter, safer laser, you can achieve the same goals but safely, effectively, and very elegantly. So for example, it's like going to the gym and lifting like this lighter weights but doing more reps, or you can go to the heavy weights and do like 2 reps with like the really heavy weights. You want to go to the Clear and Brilliant side where it's a lighter weight with more reps because it's a safer approximation to your goal to clear the melasma, and that's my preference. So Clear and Brilliant Touch is a dual wavelength, very light, superficial, safe laser, and there's 2 wavelengths. One is a 1440 nanometer handpiece, which helps with texture, wrinkles, pore size, collagen stimulation, anti-aging, all the good stuff. But then the 1927 nanometer handpiece is made and engineered for hyperpigmentation. And this laser was specifically engineered for lightening pigmentation and melasma in darker skin tones. So of course I love Clear and Brilliant. Usually when I use Clear and Brilliant, I also combine topical therapy with my patients who are having the Clear and Brilliant treatments, and those 2 together knock it out of the park every time. So usually we'll have 3 Clear and Brilliant treatments spaced 1 month apart, and in the interim between the treatments, he or she will use a hydroquinone, or some patients prefer a non-hydroquinone skin brightener, vitamin C, azelaic acid, kojic acid. There's so many, and we'll get into that. Also, the different active ingredients that can help lighten up the skin and correct melasma from a topical standpoint. But usually the Clear and Brilliant is my favorite laser for melasma in all skin tones. Now, you can adjust the settings, there's different levels and whatnot, but I won't dive into that in this video. Maybe we'll save it for another one for those who are more interested. Another laser that's really great is actually this guy right here, Pico. So the Pico laser, it's Pico because it's a picosecond, which is a trillionth of a second, which is super fast. And what that translates to is that, I'll say it in scientific terms and then I'll kind of say it in English also. A picosecond is so fast that it shatters the melanin, and there's a photoacoustic response, meaning the melanin gets shattered, your immune system comes and eats it away and clears it away, and there's no dissipation of heat, which means there's no hyperpigmentation or post-inflammatory hyperpigmentation. So what that means in English is it's photoacoustic, it's so fast, the laser pulse is so fast that there's no heat, it just shatters the pigment and you don't get darker from it. Versus a photothermal reaction like a YAG laser or a laser that's not fast, or a longer pulsed laser will basically shatter the pigment, but there'll be dissipation of heat, and anytime there's heat in the skin, it can stimulate melanocytes to make more pigment. So that's why I like the Pico laser. Now there's 2 Picos, there's the Pico A and there's the Pico Sure. One's a 1064, 532, one's a 755. Again, I can get really nerdy and scientific if you guys want to get into it, but I'm going to try to keep it light and very, very easy to interpret. And so basically the Pico lasers for melasma are also safe and very effective too. Now between Clear and Brilliant and Pico, I usually reserve Pico for those darker, stubborn spots, like more of a spot treatment for those pigmented areas that won't go away after Clear and Brilliant. So you kind of use the safer Clear and Brilliant for a diffuse treatment over the whole face. And then if there's a few just brown spots that are more stubborn, or an area, say for example on the forehead or like the mustache area that's a little bit darker, then we hit it with the Pico, because the Pico is a little bit more aggressive. There is downtime of about 5 to 6 days where it can get a little bit darker, and the areas that are treated get scabby, and then it peels off and you have beautiful, fresh, non-pigmented, non-melasma skin underneath. But Clear and Brilliant there's no downtime at all, so that's why I prefer that one. But I feel like the Pico is the one that I use to kind of really treat the stubborn spot treatment areas, and then Clear and Brilliant is what I use for just regular melasma. Now, another laser that's worth mentioning and has gotten a lot of hype in our medical community and the literature is V-beam. So V-beam laser is a 595 nanometer wavelength laser, and it treats redness. It treats blood vessels. So it's good for rosacea. It's good for under eye dark circles that's from vasculature underneath. It's good for those little annoying capillaries on the edge of the nose. It's good for cherry angiomas, or it's good for people that just have like a flushing or kind of red appearance to them, when they take pictures with their friends and they're the ones with the red face. V-beam is your best friend for that, and it definitely clears rosacea, and I will definitely say that it clears rosacea. I mean, you have to maintain it every couple years once the rosacea is gone, but it definitely will take away the redness, and it's also a great anti-aging laser too. But V-beam has been shown in clinical trials to help treat melasma as well, because the areas of melasma patches where there's hyperpigmentation, if you have a dark brown patch right here, there's a lot of blood vessels underneath that hyperpigmented area. If you look under the microscope, those melanocytes are getting a very robust blood supply, and with more nutrients and more blood circulation to the melanocytes, the pigment producing cells, they make more melanin, and so you get a darker spot. So research has shown us that if you treat the area with a V-beam in areas of a melasma patch, and then you use some type of brightener or hydroquinone or even a Clear and Brilliant combination laser treatment with another laser, it rapidly removes the melasma patches and can lighten them significantly. So some of you may ask, well, if you're using V-beam, which is going to add heat into the skin, and then you're stimulating the melanocytes with heat, can that make it worse? And for some reason, the answer is no, and they've researched this extensively. So usually you're using it in combination with a brightener or a lightener that stabilizes the melanocytes. It reduces their ability to produce pigment. So if you use a V-beam laser in conjunction with like a vitamin C or a retinol, then it really will give you beautiful results without the risk of hyperpigmentation. So what lasers are not safe to use in melasma? And I don't want to say you're not able to use these, but if you're going to use them, you need to use them with caution, and you need to have the appropriate settings, and pre and post treat the skin again to stabilize those melanocytes. Fraxel Restore is one of my favorite lasers for anti-aging. I love it for removing wrinkles under the eyes. I love it for just resurfacing the skin. I love it for erasing acne scars. But for darker skin types, especially those with melasma, you have to be very careful. You got to tweak the settings in a certain way. You got to look at your endpoints. And before treatment, you have to have the patient use a hydroquinone for 2 months before the treatment and probably at least a month afterwards. Now, I have some patients who really want Fraxel, and they're a skin type maybe 4 or 5, and I tell them I like these other lasers better. However, if you want me to do a Fraxel treatment, or maybe Fraxel is the only option for them, or maybe they want to target other blemishes besides melasma, like acne scars or large pores or wrinkles or sun damage, then we'll go ahead and use Fraxel, but I'll use the special settings and customize it for each individual patient, and then I'll pre and post condition their skin to stabilize their melanocytes so they don't respond with making more melanin in response to the trauma from the laser. So I hope that makes sense. Okay, so here I keep talking about stabilizing the melanocytes. Like, Dr. Kappel, what does that even mean? I don't understand what you're talking about. Stabilizing the melanocytes are keeping the cells not from being too stimulated to make more melanin production. Now, areas where there's hyperpigmentation or too much melanin being produced, those melanocytes are going like way too fast. They're going faster than all the other cells. So you got to stabilize their activity and stabilize their melanin production so that the melanin isn't more produced in one area of the skin than the others, which causes a hyperpigmented patch. So you want to stabilize the melanocytes so they're not overproducing melanin. Now, how do you do that? There's various active ingredients that can stabilize melanocytes. Now, there's tyrosinase inhibitors like hydroquinone. There's other non-hydroquinone tyrosinase inhibitors. And what is tyrosinase? Tyrosinase is the enzyme that is used in the melanin synthesis pathway. So when melanin, which is pigment in our skin, is produced, it starts from L-tyrosine, and then it goes to L-dopa, and then it goes to dopaquinone, and then it goes to melanin. And you have pheomelanin, you have eumelanin, there's different types of melanin. But for all intents and purposes, there's an enzyme called tyrosinase, which is responsible as the catalyst enzyme to take the pre-melanin precursor to the endpoint melanin, which is pigmentation. So different active ingredients are engineered to stop that synthesis pathway so that the melanin production can be stabilized or lowered. So when talking about treatments for melasma, it has to be twofold. There has to be two different mechanisms of action which are very important. One is to minimize the rate at which the melanin is being produced, which is great, that's all fine and dandy. But what about the melanin that has already been produced weeks before, that's patchy and irregularly distributed in the skin? You have to lighten those melasma hyperpigmented patches that have already been formed, and you have to stop it from forming again. So it's twofold. So that's why we always talk about tyrosinase inhibitors or melanin synthesis pathway inhibitors, but we also have to talk about bleaching agents, things like alpha hydroxy acids, lactic acid, glycolic acid, ones that are going to give a chemical exfoliation that's going to exfoliate all those dead skin cells in the stratum corneum, the layer of dead skin cells that lays on top of the skin that can kind of give that dull, listless appearance to the skin. It can also give a patchy hyperpigmentation look to the skin. You have to get rid of all that melanin that's just sitting there in the epidermis in the stratum corneum. Got to get rid of that, and you got to stop it from happening again. So that's why using just maybe a hydroquinone or a melanin synthesis pathway inhibitor will be effective, but it may not take you all the way there, because yeah, you've regulated your melanocytes so you won't make more melasma, but what about the hyperpigmentation that's already there? You got to desquamate that off. So that's why usually hydroquinone will be prescribed or given with other, a chemical exfoliants, lactic acid, glycolic acid, other AHAs, BHAs, in addition to vitamin C, antioxidants. There's so many of them, and we'll list those in a minute too. But that's why there's usually combination therapy that's needed to treat melasma, because it has to have two different mechanisms of action. Throw in a laser, and then that makes everything better. So using all three forms is usually key to success for clearing melasma, and then maintenance after that by using photoprotection, and antioxidants and more natural active ingredients that are non-hydroquinones to kind of keep the melasma at bay is ideal. So you may see different products being marketed to treat melasma. And, hydroquinone sometimes gets a bad rap because it was pulled off the market in some, countries in the UK and other countries as well. And it was done because I think that there were experiments that had shown that there was some systemic absorption of the hydroquinone. But to be honest, most formulations, for example, the Zeo Skin Health Pigment Control Cream is a 4%, and it's a very, very low dose of hydroquinone. And to be honest, the higher doses of hydroquinone, like the 6% and 8%, I never prescribe those to my patients, and for a prolonged period of time can cause other deleterious effects. It's not so much a systemic absorption problem, because less than 1% of it even gets absorbed in the skin, but it can cause a phenomenon called ochronosis, where there's pigment distribution from the hydroquinone, which can make melasma and hyperpigmentation worse. So if you're using hydroquinone, it's nothing to be afraid of, especially if you're being dosed and prescribed by a physician. But for my practice, I never really have patients on it for a long, prolonged period of continuous use for more than 3 months, and I never go above a 4%. Because going above a 4%, if you're using a 6 or 8%, you're just subjecting yourself to ochronosis and some of those bad side effects, and you're not really getting that much more effectiveness. Hydroquinone becomes much more effective when you combine it with other active ingredients: retinol, vitamin C, other antioxidant, kojic acid, and azelaic acid, and other natural enzymes that can help inhibit melanin synthesis. But for the sake of completeness, I wanted to list a few, and I did make a list. So vitamin C is one of my favorite skin brighteners. And even in my line, MDR, I have the vitamin CFK, which is a 15% L-ascorbic acid. It has THC, and it has various forms of vitamin C. L-ascorbic acid has the most data, research, and evidence proving its effect for overall skin health, anti-aging, and most importantly, melasma. So I love L-ascorbic acid. It is, as a formulator, I can say this, it is very hard to formulate, and the vehicle delivery systems have to be exceptional and very cosmetically elegant in order to get it into the skin where it can take effect by protecting its stability, which I've spent years and years studying and engineered my own. But for most products, vitamin C is very important, and out of all the forms of vitamin C, L-ascorbic acid is the most effective. Then we have kojic acid, ferulic acid, I have my notes here, tranexamic acid topically. I'm not a big fan of oral tranexamic acid, but topically, yes, retinol, glycolic acid, lactic acid, niacinamide, phytic acid, and bucochiol. I always pronounce that wrong, but most of these active ingredients work in different mechanisms, and when combined together, they can be pretty effective, almost as effective as a hydroquinone, and they could be safe with long-term use. And a lot of these, not the tranexamic acid or the retinol, are safe for pregnancy. So I love antioxidants and vitamin C for pregnancy, especially, with all the hormones of pregnancy, all the estrogens make the melanocytes all revved up. That's why pigmentation occurs not only on your face, but all over on the body during pregnancy. But vitamin C is a very safe and effective brightener to use to treat melasma during pregnancy and breastfeeding. And last but certainly not least, you can't forget sunscreen. So that is a key component to a skincare regimen. Post-melasma treatment, and even when you're trying to treat melasma and you're actively treating melasma, sunscreen is so important, not only from the sun, not only from UVA and UVB light, but also from the infrared light from our devices, from our screens, the fluorescent lights. These create heat, these stimulate melanocytes, these make melanin, they make your melanocytes go crazy. I even have a patient who's a radiologist, and she's indoors all day. She works night shifts, she's never in the sun, and she wears sunscreen, but still through her, because of the screen, she's staring at images all day, she has horrible melasma. So we had to add a sunscreen that had iron oxides to help protect against the HEV blue light and infrared light that's emitted from our devices. And in conjunction with laser therapy, we've helped clear her melasma and helped keep it gone. But even with somebody who doesn't go in the sun, you're doing hot yoga, you're, on a screen. I mean, you have to live your life. And of course, I live on the beach. My son's a surfer. I spend a lot of time outdoors. I grew up surfing, but with melasma, but I've always really photoprotected my skin. So it's really important to have a sunscreen that has iron oxides in it, because that also protects against the non-UV light that can make melasma flare. Another key tidbit I'd like to tell people is HelioCare. HelioCare is an antioxidant plant-based enzyme. You can get HelioCare Ultra, Advanced, or the regular HelioCare, which is a little bit less expensive. I think it's a better price point, and it has something called polypodium leukotomas in it. And you hear me talk about this all the time if you follow me on Instagram or my stories. I love HelioCare because even for myself with my melasma, when I skip my HelioCare, I start to see my melasma start creeping in. I get it on my forehead, and I start to get it like right here. So it's a combination of different things. But when it takes a lot of work, but if you use HelioCare supplements, you use your sunscreen with iron oxides, you're using skincare products every day that can naturally and antioxidant based help your melasma, and then you do laser treatments if you want to, or if you're up for it, if you're down, that's the best way to treat melasma. And just remember, everybody's melasma is different. Even melasma on your own face may be different, varying in different areas of your face. So, some will respond to one type of laser, you'll need a different depth for another, and just don't give up, and don't give up if somebody tells you, okay, you're not a candidate for melasma, you're just gonna have to deal with it. I've had patients who are referred to me from other doctors who have told them that they're just not a candidate, they just have to live with it and cover it up with makeup. So if I can treat my melasma, I can treat any of yours, and I hope this helps. I hope you can share this with someone who may find it useful. I hope you can subscribe and join my YouTube skincare derm nerd family, and thank you so much for watching.